Now, let's talk about what are these terms like headaches. We should be knowing about it. If we are talking about pain and we are not talking about headaches, it is not a justice. So, what are headaches? Now, headaches are actually the type of referred pain on the surface of head from the deeper structures. There are different types, different causes. As you can see that headaches are a type of pain which is referred to the surface of the head from deep head structures, and it do result either from pain stimuli arising inside the cranium, but others result from pain arising outside the cranium as well. Now there are different causes which can lead to development of headaches, like there can be inflammation of meninges like meningitis. If there is low pressure of cerebrospinal fluid, there's migraine, there is alcohol intake, there is constipation, there is presence of eye disorders, there is irritation in the nasal areas, etc. So let's talk about the pain sensitive areas over there in the cranial vault. The brain tissues themselves are almost totally insensitive to pain. The pain of headache is not caused by damage within the brain itself. Tugging on the venous sinuses around the brain, there is if damaging the tentorium, or there is stretching of the dura mater at the base of the brain, they can cause intense type of pain which is recognized as headache. Traumatizing, crushing, stretching stimulus to the blood vessels of the meninges, they can lead to a headache. Sensitive structure like middle meningeal artery, and the neurosurgeons are careful to anesthetize this artery specifically when performing brain operation under local anesthesia. Now, the types of headache, there can be intracranial headache and extracranial headache. Now, areas of the head to which the intracranial headache is referred. If there is stimulation of pain receptors in the cerebral vault above the tentorium, there is initiation of the pain impulses in the cerebral portion of the fifth nerve, and they cause referred headache to the front half of the head in the surface areas supplied by somatosensory portion of fifth cranial nerve. Pain impulses from beneath the tentorium, they're going to enter the CNS, the central nervous system, via 9th nerve, 10th nerve, and 2nd cervical nerve, which are glossopharyngeal nerve, vagal nerve, 2nd cervical nerve, supplying the scalp above, behind, and slightly below the ear. So subtentorial pain stimuli, they cause occipital headache, referred to posterior part of the head. Now, the types of intracranial headaches. There are different types of headaches, like headache due to meningitis, headache due to low cerebrospinal fluid pressure, migraine headaches, alcoholic headaches, headaches related to long-standing constipation condition, irritation of nasal and adjacent areas, eye disorders. Now, areas of headache resulting from different causes. You can see that the areas which are being involved, like if there is something wrong over there in the brainstem and cerebellar areas, then we have most of the time headaches over there in the back of the head. And then we have the cerebral vault headaches. There is presence of headache involving the eye area, the nasal sinuses area, etc. Headache of meningitis. One of the most severe headaches of all is that resulting from the inflammatory condition of meninges, that is meningitis. including the sensitive areas of the dura and the sensitive areas around the venous sinuses. Such intense damage can cause extreme headache, pain referred over the entire head. Now, another term that is due to of headache can be due to low cerebrospinal fluid pressure. It has been observed that if there is removal of as little as even 20 ml of fluid from the spinal canal, particularly in the person who is in upright position, causes intense intracranial headache. Removing this quantity of fluid removes part of the flotation for the brain that is normally being provided by the cerebrospinal fluid, and the weight of the brain stretches and distorts the various dural surfaces, and thereby it elicits the pain which is going to cause the headache. So you should be knowing about these conditions if any scenario related to them that is there. Then another condition which is very frequently observed and very frequently being asked for in an outpatient department, that is the migraine. It is a special type of headache that may result from abnormal vascular phenomena. That exact mechanism is unknown. So, this is a special type of headache, remember, which is resulting from abnormal type of vascular phenomena over there in the brain, and the exact mechanism is not still known. Migraine often begins with various prodromal features, prodromal conditions, sensations. So what are they? They are like that there is feeling of nausea is there is loss of vision, the person becomes irritable, there is field of vision actually decreases, there is visual aura, there is photophobia, there is discomfort for noisy conditions, there is presence of other types of sensory hallucinations. So most of the times this condition actually begins this prodromal condition remains there for like 30 minutes to 1 hour time before the beginning of exact headache. Prolonged emotion or tension causes reflex vasospasm of some of the arteries of the head also, which are supplying the blood to brain. So this condition can lead to headache as well. The vasospasm theoretically produces ischemia of that particular portion of the brain and is responsible for the prodromal symptoms. So as a result of intense ischemia, something happens to the vascular walls. There is exhaustion of smooth muscle contraction to allow the blood vessels to become flaccid and incapable of maintaining vascular tone, and is going to be there for like 24 to 48 hours. The blood pressure in the vessels causes them to dilate and pulsate intensely. The excessive stretching of the walls of the arteries, such as temporal artery, causes the actual pain of migraine headaches. Other cause of migraine headaches, there can be depression, psychological abnormalities, vasospasm due to excessive local potassium in the cerebral extracellular fluid, genetic background, female gender, there is familial disposition. There are several types of migraine headache, but most are characterized by severe pain on one or both sides of head, which may move to the other side. There is nausea, dizziness, visual disturbances caused by dilation and constriction of the blood vessels in the head. Alcoholic headache. Alcohol is toxic to tissues. It directly irritates the meninges and causes the intracranial pain. Dehydration may also play a role in the hangover. Then we have the extracranial types of headache. Different types are due to muscle spasm, irritation of nasal and accessory nasal structures, due to eye disorders. Due to muscle spasm, emotional tension often causes many of the muscles of the head, especially muscles which are attached to scalp, attached to occiput, to become spastic, and the pain of spastic head muscles is referred to the overlying areas of the head. Then there is irritation of nasal and accessory nasal structures, infection or other irritative processes in the widespread areas of the nose and nasal structures, adjacent areas, the pain behind eyes, and in case of frontal sinus infection, cause headache that is referred to frontal surfaces of the forehead and scalp. From the maxillary sinuses can be felt even on face as well. Headaches due to eye disorders. Difficulty in focusing one's eye clearly may cause excessive contraction of eye ciliary muscles in an attempt to gain clear vision. These muscles are extremely small. Tonic contraction can cause retroorbital headache. Excessive irradiation of light rays, especially ultraviolet rays, they can lead to development of headache. As you can observe yourself that on a sunny day, if you are like out in the sun for a couple of hours or so, you develop headache. Looking at the sun or the arc welder for even few seconds can even result in headache, which is going to last for like 24 to 48 hours. So this is all about the different conditions which are related to pain, like hyperalgesia, tic douloureux. We have headaches, the types of headaches, what is herpes zoster, shingles. So these all conditions, they are very important regarding the pathophysiology related to pain sensation. So all of you are like supposed to prepare these conditions. One of them can come in the form of a scenario-based question related to pain. So that's all for today, and thank you very much. God bless you all. Allah Hafiz.